What's happening, everyone? Dr. Elena Morrison here from Senior Health Tips, and today I'm going to share something that most urologists will never tell you in the exam room, something they know, something they teach their colleagues, but something they rarely explain to patients. I'm talking about prostate medications, specifically the drugs prescribed to millions of men over 60 for enlarged prostate or BPH, benign prostatic hyperplasia. Drugs like finasteride, dutasteride, and alpha blockers like tamsulosin and alfuzosin. Here's the uncomfortable truth. Most urologists, when they start experiencing prostate symptoms themselves, don't take these medications, at least not long term, and definitely not as a first-line approach. Why? Because they know something you don't. They know the side effects, they know the limitations, and they know there's a better way. Now, before you think, here's another doctor telling me to ignore my symptoms, let me be very clear. I'm not here to tell you to refuse treatment. I'm here to show you what urologists do instead. The lifestyle interventions, the exercise protocols, the dietary strategies that work without the sexual dysfunction, without the dizziness, and without the long-term risks. By the end of this video, you'll know. Number 1. Why the most common prostate medications come with side effects that urologists themselves refuse to accept. Number 2, the exact exercise protocol urologists use to shrink prostate symptoms naturally, backed by peer-reviewed research. Number 3, the dietary pattern that reduces BPH progression by up to 33%. Number 4, the pelvic floor strengthening routine that improves urinary flow without pills. And number 5, when medication actually is necessary, and which ones urologists choose when they can't avoid it. Stay with me until the end because I'm going to give you the complete urologist-approved prostate protocol you can start today, whether you're newly diagnosed, already on medication, and want to get off or trying to prevent BPH in the first place. And if you've ever felt like your doctor was too quick to hand you a prescription without explaining the alternatives, you already understand why this conversation matters. Now let's get into it. Let's start with the truth. The two main classes of prostate medications prescribed in the United States are 5-alpha reductase inhibitors, finasteride and dutasteride, and alpha blockers like tamsulosin, alfuzosin, and doxazosin. Millions of prescriptions are written every year, and for some men, these medications provide real symptom relief. But here's what the medical literature shows, and what urologists discuss privately. The 5-alpha reductase inhibitors, finasteride and dutasteride. These drugs work by blocking the conversion of testosterone to dihydrotestosterone, or DHT. Lower DHT means the prostate shrinks over time. Sounds good, right? Except for one major problem. DHT isn't just involved in prostate growth. It's involved in sexual function, mood regulation, and neurological health. Research published in the Journal of Clinical Andrology found that men taking finasteride reported new-onset persistent sexual dysfunction, including low libido, erectile dysfunction, and problems with orgasm, even after stopping the medication. This isn't rare. Clinical trials show erectile dysfunction occurs in approximately 9% of men on finasteride and even higher with dutasteride. Decreased libido affects 3 to 6%. Ejaculatory dysfunction affects 3 to 4%. And here's the part that alarms urologists. Some men report that these side effects persist even after stopping the drug. This is called post-finasteride syndrome. The UK government issued a drug safety update in 2024, reminding clinicians of the risk of psychiatric side effects and persistent sexual dysfunction. Now ask yourself, if you were a urologist in your 50s or 60s, starting to experience mild urinary symptoms, would you take a drug that has a 9% chance of causing erectile dysfunction and a small but real risk of permanent sexual side effects? Most urologists I know say no. Alpha blockers, tamsulosin, alfuzosin, doxazosin. These drugs relax the smooth muscle around the prostate and bladder neck, improving urine flow. They work faster than 5-alpha reductase inhibitors, usually within days to weeks, but they come with their own set of problems. The most common side effects include dizziness, Postural hypotension. That's a sudden drop in blood pressure when you stand up. And retrograde ejaculation, where semen goes backward into the bladder instead of out. Research shows that alpha blockers increase the risk of ejaculatory dysfunction significantly. Some studies report retrograde ejaculation in up to 10 to 15% of users. And here's what urologists know, but patients often don't. Alpha blockers don't shrink the prostate. They only relieve symptoms. So you're taking a drug every single day with side effects for symptom management, not disease modification. When urologists start experiencing early BPH symptoms, most of them don't rush to the prescription pad. They do something else first, and that's what we're going to cover next. Before I show you the exact exercise protocol and dietary pattern urologists use to avoid these medications, if you're realizing right now how many men are put on drugs without being told about the alternatives, hit subscribe. On Senior Health Tips, I don't just repeat what the pharmaceutical industry wants you to hear. I show you what doctors do for themselves, and I give you the same protocols they follow. Here's the first strategy urologists use when they start noticing prostate symptoms. Targeted exercise. Not just stay active. Specific exercises designed to improve pelvic floor function, reduce inflammation, and improve urinary control. Number 1, pelvic floor muscle training. Kegel exercises for men. Most people think Kegels are only for women. Wrong. Pelvic floor muscle training is one of the most effective non-pharmacological interventions for BPH symptoms. Research published in PMC, that's PubMed Central, found that combining pelvic floor muscle training with urgency suppression techniques significantly improved urinary symptoms in men with BPH. Here's how urologists do it. First, identify the correct muscles. The easiest way is to stop your urine midstream next time you're in the bathroom. The muscles you use to do that are your pelvic floor muscles. Once you've identified them, you can do Kegels anywhere. You don't need to be urinating. The protocol. Contract your pelvic floor muscles and hold for 5 seconds. Relax for 5 seconds. Repeat 10 times. Do this 3 times per day, morning, afternoon, evening. As you get stronger, increase the hold time to 10 seconds. Why this works. Strengthening the pelvic floor improves bladder control, reduces urgency, and can improve urinary flow by supporting the bladder neck and urethra. Studies show that men who do pelvic floor exercises consistently for 8 to 12 weeks report significant improvement in urinary symptoms without medication. Number 2, aerobic exercise. Walking, cycling, swimming. Research from the Urology Care Foundation and multiple universities shows that regular aerobic exercise reduces BPH symptoms and improves quality of life. One study found that men who exercised aerobically for at least 150 minutes per week, that's 30 minutes 5 days a week, had a 33% lower risk of BPH progression compared to sedentary men. Why this works. Aerobic exercise reduces systemic inflammation, improves blood flow, helps maintain a healthy weight, and reduces insulin resistance, all factors that contribute to prostate health. The urologist protocol. 30 to 45 minutes of moderate intensity aerobic exercise 5 days per week. This could be brisk walking, cycling, swimming, or rowing. The key is consistency. Number 3. Resistance training, but done correctly. Heavy lifting and straining can actually worsen BPH symptoms by increasing intra-abdominal pressure. But moderate resistance training, when done with proper breathing technique, improves muscle mass, reduces inflammation, and supports metabolic health. The urologist approach, 2 to 3 days per week of moderate resistance training. Focus on compound movements like squats, lunges, rows, and presses. Use weights you can control with good form. And here's the key. Exhale during the effort phase. Never hold your breath and strain. That increases pressure on the pelvic floor and can worsen symptoms. Number 4. Stretching and mobility work, especially hip flexors and hamstrings. Tight hip flexors and hamstrings can restrict blood flow to the pelvic region and contribute to pelvic floor tension. Urologists who practice yoga or regular stretching report better urinary control and fewer BPH symptoms. The protocol: 10 to 15 minutes of stretching daily, focusing on hip flexors, hamstrings, glutes, and lower back. Simple stretches like the pigeon pose, butterfly stretch, and seated forward fold are highly effective. Here's the bottom line. Most urologists, when they start experiencing early BPH symptoms, implement this exercise protocol first, and many of them never need medication. Now let's talk about diet, because what you eat has a direct impact on prostate size, inflammation, and urinary symptoms. Research from the Mayo Clinic, Johns Hopkins, and the American Cancer Society consistently shows that certain dietary patterns reduce BPH risk and slow progression. Here's what urologists follow when they want to protect their own prostates. Number 1, plant-forward, Mediterranean-style eating. Multiple studies show that men who follow a Mediterranean diet, rich in fruits, vegetables, whole grains, legumes, nuts, seeds, and olive oil, have significantly lower rates of BPH and slower progression. One large study found a 33% reduction in BPH risk among men with the highest adherence to a Mediterranean dietary pattern. Why this works? This eating pattern reduces chronic inflammation, improves insulin sensitivity, supports healthy hormone metabolism, and provides antioxidants that protect prostate cells. The Urologist plate. At every meal, aim for 50% vegetables, 25% lean protein, preferably fish or plant-based, and 25% whole grains or starchy vegetables. Use olive oil as your primary fat source. Number 2, cruciferous vegetables daily. Broccoli, cauliflower, Brussels sprouts, kale, bok choy, and cabbage contain compounds called glucosinolates that support healthy hormone metabolism and may reduce prostate inflammation. The protocol: at least 1 serving of cruciferous vegetables per day. Lightly steamed or sautéed is ideal. Don't overcook, as this destroys some of the beneficial compounds. Number 3, limit red meat and dairy, especially whole-fat dairy. As we discussed in the previous video on dairy and prostate cancer, high intake of red meat and full-fat dairy is associated with increased BPH risk and faster progression. The urologist approach: limit red meat to once or twice per week maximum. Choose grass-fed, lean cuts when you do eat it. Eliminate whole milk and full-fat dairy. If you consume dairy, stick to low-fat options in moderation. Number 4, increase omega-3 fatty acids. Fatty fish like salmon, sardines, mackerel, and anchovies provide omega-3 fatty acids that reduce inflammation and support prostate health. The protocol: 2 to 3 servings of fatty fish per week. If you don't eat fish, consider a high-quality omega-3 supplement, 1,000 to 2,000 milligrams of EPA plus DHA per day. Number 5, avoid or minimize alcohol and caffeine. Both alcohol and caffeine are bladder irritants. They increase urinary frequency and urgency. Most urologists with BPH symptoms significantly reduce or eliminate both. The approach: limit caffeine to 1 cup of coffee or tea in the morning. Avoid caffeine after noon. Limit alcohol to 1 drink per day maximum, or eliminate it entirely if symptoms are bothersome. Number 6, hydrate strategically. This sounds counterintuitive, but proper hydration actually improves urinary symptoms. Dehydration leads to concentrated urine, which irritates the bladder and worsens urgency. The urologist strategy: drink 8 to 10 glasses of water throughout the day. Front-load your hydration. Drink most of your fluids before 6 p.m. After 6 p.m., sip only as needed. This prevents nighttime urination while keeping you properly hydrated during the day. Number 7, specific foods and supplements with evidence. Some natural compounds have modest but real effects on BPH symptoms. These include saw palmetto extract, beta-sitosterol, pygium, and pumpkin seed extract. The evidence is mixed. Some studies show benefit, others show no effect. But many urologists with mild symptoms try these before reaching for prescription medications. The approach. If you want to try supplements, look for standardized extracts. Saw Palmetto, 320 milligrams per day. Beta-sitosterol, 60 to 130 milligrams per day. Pyjam, 100 to 200 milligrams per day. Give it 8 to 12 weeks before deciding if it's working. Here's the key. Urologists don't rely on supplements alone. They use them as part of a comprehensive lifestyle approach: exercise, diet, stress management, and pelvic floor training. Let me tell you about a colleague of mine I'll call James. He's a urologist, 58 years old, started noticing he was getting up twice a night to urinate. Weak stream, hesitancy starting urination, classic early BPH symptoms. He knew exactly what medications he could prescribe himself, but he also knew the side effects, and he wasn't willing to accept a 9% chance of erectile dysfunction for mild symptoms. So here's what James did instead. He started doing pelvic floor exercises, Kegels, 3 times per day. Every morning, every afternoon, every evening. 10 repetitions, 10-second holds. He committed to 30 minutes of brisk walking 5 days per week. He switched to a Mediterranean-style diet, cut out red meat almost entirely, eliminated whole dairy, ate fish 3 times per week, loaded up on vegetables. He also implemented what he calls his liquid curfew. No fluids after 6:30 p.m. He front-loaded his hydration during the day. He cut caffeine to 1 cup of coffee in the morning only, and he added a supplement stack: saw Palmetto, beta-sitosterol, and Pyjam. Within 4 weeks, James noticed his nighttime urination dropped from 2 times per night to once per night. Within 8 weeks, many nights he slept through without getting up at all. His stream improved. His hesitancy decreased, and he never took a single prescription medication. Now, 6 years later, James still follows this protocol. His symptoms are minimal. He occasionally has a mild flare-up, usually when he's traveling and his routine gets disrupted. But overall, he's managed his BPH without medication. I'm not telling you James's story to promise you'll have the same results. Individual cases vary, but I'm telling you this because urologists like James know that, for mild to moderate BPH, lifestyle interventions work, and they avoid the side effects that medications bring. Now let's talk about the elephant in the room. Sometimes medication is necessary, sometimes symptoms are severe enough, or quality of life is impacted enough. That lifestyle interventions alone aren't enough. So what do urologists do in that situation? Here's the hierarchy. First choice, alpha blockers for short-term symptom relief. If a urologist needs medication, most will choose an alpha blocker first, usually tamsulosin or alfuzosin. Why? Because alpha blockers work quickly. They don't carry the sexual dysfunction risk that 5-alpha reductase inhibitors do, and they can be used short-term while lifestyle changes take effect. The approach: start the alpha blocker. Simultaneously implement the full lifestyle protocol: exercise, diet, pelvic floor training. After 3 to 6 months, try tapering off the alpha blocker. Many men find that once their lifestyle is dialed in, they no longer need the medication. Second choice, 5-alpha reductase inhibitors, but only for large prostates. Urologists will consider finasteride or dutasteride if the prostate is significantly enlarged, typically greater than 40 to 50 grams, and if the patient is informed about the side effects and accepts the risk. The key: these drugs are most effective in men with large prostates. If your prostate is only mildly enlarged, the risk-benefit ratio doesn't favor these medications. Third choice, combination therapy, alpha blocker plus 5-alpha reductase inhibitor. For men with severe symptoms and large prostates, combination therapy may be necessary. But even then, urologists will often use the combination for 6 to 12 months. Then try to taper off the alpha blocker once the 5-alpha reductase inhibitor has had time to shrink the prostate. Here's what urologists almost never do for themselves: take medication indefinitely without addressing lifestyle. because they know that medication without lifestyle modification is a band-aid. It doesn't address the root causes: inflammation, poor diet, sedentary behavior, metabolic dysfunction. Here's your complete action plan. Follow this in order. Step 1. Implement the exercise protocol. Start today. Pelvic floor exercises. Kegels, 3 times per day. Aerobic exercise, 30 to 45 minutes, 5 days per week. Moderate resistance training, 2 to 3 days per week. Daily stretching, 10 to 15 minutes, focusing on hips and hamstrings. Step 2. Adopt the Mediterranean dietary pattern. Meals should be 50% vegetables, 25% lean protein, 25% whole grains, daily cruciferous vegetables, fatty fish 2 to 3 times per week. Eliminate or minimize red meat and whole-fat dairy. Limit caffeine to morning only. Limit alcohol to 1 drink per day or eliminate. Step 3. Hydrate strategically. 8 to 10 glasses of water per day. Front-load hydration. Most fluids before 6 p.m. Liquid curfew after 6:30 p.m. Step 4. Consider evidence-based supplements. Saw Palmetto 320 milligrams per day. Beta-sitosterol 60 to 130 milligrams per day. Pygium 100 to 200 milligrams per day. Give it 8 to 12 weeks. Step 5. Track your symptoms. Keep a urinary diary. Track how many times you urinate during the day and at night. Track your stream strength, hesitancy, and urgency. Measure progress every 4 weeks. Step 6. If on medication, work with your doctor to taper. If you're already on alpha blockers or 5-alpha reductase inhibitors, do not stop cold turkey. Work with your urologist. Implement the lifestyle protocol fully for 3 to 6 months. Then discuss a gradual taper. Many men can successfully reduce or eliminate medication once lifestyle is optimized. Step 7. Get regular monitoring. Annual prostate exam and PSA test. If symptoms worsen despite lifestyle interventions, consider urodynamic testing or imaging to rule out other causes. Now listen carefully. There are certain symptoms that mean you need to see a urologist this week, not eventually. Red flag number 1, complete inability to urinate. If you cannot urinate at all, this is acute urinary retention. It's a medical emergency. Go to the ER immediately. Red flag number 2, blood in the urine. Occasional microscopic blood can happen, but visible blood, especially if persistent, requires immediate evaluation to rule out bladder cancer, kidney stones, or severe infection. Red flag number 3, severe pain with urination or in the pelvic region. This could indicate prostatitis, bladder infection, or kidney infection. Don't wait. Red flag number 4, new onset urinary incontinence. If you're suddenly leaking urine or having accidents, this warrants urgent evaluation. Red flag number 5, elevated PSA with rapid rise. If your PSA is rising rapidly, more than 0.75 nanograms per milliliter per year, or if your PSA is significantly elevated, you need imaging and possibly a biopsy to rule out prostate cancer. The bottom line, lifestyle interventions work for mild to moderate BPH, but if you have severe symptoms, don't ignore them. See a specialist. Now let's talk about timeline and expectations. Week 1 to 2. You may not notice much change yet. Focus on building the habits: exercise, diet, hydration timing, pelvic floor exercises. Week 4, many men start noticing subtle improvements: slightly stronger stream, slightly less urgency, maybe 1 fewer nighttime trip to the bathroom. Week 8, this is when most men see meaningful improvement. Stream strength improves, urgency decreases. Nighttime urination often drops by 1 to 2 episodes. Month 3 to 6. Symptoms continue to improve. Many men find they no longer need medication or can taper to a lower dose. Long term. As long as you maintain the lifestyle changes, symptoms remain controlled. If you slip back into old habits, sedentary behavior, poor diet, alcohol, symptoms will return. This is not a quick fix, but it's a sustainable fix, and it's the approach most urologists follow for themselves. Here's what I want you to remember. The pharmaceutical industry has spent billions convincing doctors and patients that prostate medications are safe, effective, and necessary. And for some men, they are necessary. But for many men, especially those with mild to moderate symptoms, medication is not the first answer. It's the last resort. Urologists know this. They live this. When they develop prostate symptoms, most of them try lifestyle interventions first. They exercise. They change their diet. They do pelvic floor training. And many of them never need medication. You deserve the same information. You deserve the same protocols. And you deserve to make an informed choice, not a default prescription. So here's my challenge to you. For the next 90 days, implement the complete protocol. Exercise, diet, hydration timing, pelvic floor training. Track your symptoms and see if the data speaks for itself, because I would rather you try the approach urologists use for themselves and succeed without medication than to accept side effects you were never told about. If this video opened your eyes to what urologists do for themselves versus what they prescribe to patients, do 3 things right now. First, subscribe to Senior Health Tips. I'm not here to repeat pharmaceutical talking points. I'm here to show you what doctors do behind closed doors. Second, comment the word protocol below, and I'll pin the complete exercise and diet plan so you can screenshot it. Third, share this with one man over 60, because millions of men are on prostate medications they may not need, and most of them have no idea there's another way. I'm Dr. Elena Morrison. Your health is your power, and I'll see you in the next video.